Welcome to our All About Diabetes. Today's presentation will be about micronutrients which are important for diabetic patients. The content of these presentations is based on studies published in medical journals. In no case is it recommended to stop the treatment indicated by your personal medical doctor. The main micronutrients with an important role in diabetes are chromium, zinc, magnesium and vanadium. We will start with chromium. Chromium has a very important role in glucose metabolism, dyslipidemia, weight loss, body composition and bone density. The daily dosage recommended is 25 micrograms for women and 35 micrograms for men. What does chromium in diabetes? It increases the number of insulin receptors. It increases binding of insulin to the insulin receptor, and it increases activation of the insulin receptor in the presence of insulin. So the final outcome is a lower hemoglobin A1C. Of course, if we take large doses of chromium, we can experience side effects like renal and hepatic toxicity, rhabdomyolysis, psychiatric disturbances and hypoglycemia. It decreases zinc absorption and may compete with iron for transport on transferrin. It is also important to know that vitamin C and aspirin may increase chromium absorption, but in cell culture studies, vitamin C enhances chromium's genotoxic effects. So scientists are still debating regarding vitamin C and chromium interactions. The second micronutrient that we will discuss in this presentation is zinc. It is known that zinc levels in serum are decreased in diabetes due to excessive urination. Zinc deficiency is more prevalent among uncontrolled type 2 diabetes compared with type 1 diabetes. Zinc is very important for our organism because it has anti-inflammatory effects, preserves cell health and insulin sensitivity, decreases the level of cholesterol and hemoglobin A1C levels in blood, and it is involved in formation of insulin crystals, release of insulin and transport of insulin. Daily intake recommended for people over the age of 19 is 11 mg for men and 8 mg for women. Good dietary sources are oysters, red meat, poultry, beans, nuts, whole grains, fortified breakfast cereals, dairy products. Magnesium is also very important. It is an essential cofactor for more than 300 enzymes. Also, magnesium deficiency has been associated with hypertension, cardiovascular disease, dyslipidemia, increased platelet aggregation, insulin resistance, glucose intolerance, complications of diabetes, complications of pregnancy, decreased magnesium levels and increased urinary magnesium losses are encountered in type 1 and type 2 diabetic patients. It is recommended to add 350 mg per day magnesium to our diet. Patients with diabetic retinopathy and patients with neuropathy have lower magnesium levels. Side effects of high intakes of magnesium include hypotension, headaches, nausea, altered cardiac function and central nervous system disorders. It is also very important to pay special attention to patients with renal insufficiency. Good dietary sources include whole grains, leafy green vegetables, nuts and fish. The last micronutrient we will discuss today is vanadium. So vanadium alters lipid and glucose metabolism by enhancing glucose oxidation, alters glycogen synthesis, alters hepatic glucose output. It is an insulin mimetic agent and enhances insulin activity and increases insulin sensitivity. The usual diet is estimated to provide 10 to 60 micrograms per day. If we supplement our diet with vanadium, we have to limit our daily intake to under 100 micrograms per day. Side effects include anorexia, decreased food and fluid intake, weight loss. Good dietary sources for this micronutrient are black pepper, dill, parsley, mushrooms, spinach, oysters, shellfish, cereals, fish, wine. Thank you very much for your attention. I hope you enjoyed the presentation. Please like and subscribe.